I'm Robin Lee. I am the executive director of the Spina Bifida Association of North Texas. We are located in Arlington, Texas, which is right between Dallas and Fort Worth. We're about 5 minutes from where the Dallas Cowboys and our world champion Texas Rangers play. So we are a great and central hub to all of North Texas for supporting. I also have a 25-year-old daughter with Spina Bifida, so I have a lot of experience.
Awesome. Awesome. And we know that spina bifida is something that affects a larger percentage of the population, really, than I think sometimes people realize. But there's also a lot of kiddos walking around that you would never even guess. So we just wanted to kind of open things up and learn a little bit from you and some of the resources and everything that you've got going on for your members of your Spina Bifida Association down in Texas. So with that being said, can you first kind of share with us some of the common challenges your members of the organization face related to their self-cathing with spina bifida?
Well, there's a lot of challenges that they face, and that starts with when they're babies. Not all individuals with spina bifida have to be cathed right away. So sometimes they have to be cathed when they're babies. Sometimes they don't have to cath until several months or several years later. Usually by their teens, if they're going to have to cath, they learn to cath. But as the parents have to learn this process, depending on when it is, that provides challenges because a lot of them become very anxious. This is a medical procedure that they never thought that they would have to do in their life. Now they're learning to have to do this, especially if their child is a baby. It's just trauma once again about the diagnosis of spina bifida and them reliving all of that. Or maybe they're a little bit older and they thought, oh good, I'm not going to ever have to cath my child, and now I'm going to have to. What did I do wrong? So they have a lot of challenges then. And then as the child gets older, just the challenges kind of change. You learning to cath in public, having to find accessible restrooms, having to find, even if it's an accessible restroom, do you want to have to change your baby on the floor when you go into a public restroom? Right. It's not a clean place to change or clean a child. And when they're babies, a lot of times they'll fit on the changing tables. But as your child gets older and 3 or 4 or 5 and you have to lay them down to cath, those changing tables don't always work very well. So then you're then you're doing it in the back of your car. So right. As they have to learn to cath at school, those become not only challenges to work with the nurses and the school administration, but cathing in a nurse's office, but also making sure that they work with your child on their school schedule and they allow them to get out of class when they're supposed to cath. It's very important for them to be on a schedule when they're cathing. When they become teens, their challenges change more because you've sent your teen off into the world, into school, and they're supposed to be cathing at school and cathing at home, and they really are really tired of all the medical things that are going on in their life, and they want to maintain some control. And sometimes that means they become stubborn and they do not want to cath, and they just stop cathing. They don't care that they've soiled themselves. They don't care that they smell. They're just maintaining some control. So getting over that hump and making them realize, oh, you have to cath because this is the best way to maintain your kidneys and your health. You don't want your child to become septic because they're not maintaining their health with proper catheterization. And the same thing that can lead into adulthood. When you have a job, people notice that you're cathing, or maybe you have accidents because you don't cath properly. So all those technical issues with cathing are important to maintain their health.